Welcome to Holistic Health for Happy Kids, the podcast where we dive into the root causes of children's health challenges and explore natural solutions to help little ones thrive. I'm Lisa, a passionate paediatric naturopath and mum of 3, dedicated to empowering parents with practical tips and expert insights to raise healthy, happy kids. Each episode will unpack common childhood health concerns like allergies, eczema, fussy eating, and gut health, and share evidence-based advice to support your child's wellness naturally. Let's create a generation of thriving children, one holistic step at a time. Thank you for joining me on this journey. Hello, and welcome to this episode of Holistic Health for Happy Kids. And today I'm joined by Dr. Elisa Song, who is a Stanford, NYU, UCSF-trained integrative pediatrician and pediatric functional medicine expert, and most importantly, a mother of 2 thriving children. So Dr. Song is the national best-selling author of the book Healthy Kids, Happy Kids, which you see behind me, and the visionary founder of Healthy Kids, Happy Kids, the go-to resource for families and practitioners seeking trusted, evidence-based root cause solutions for children. She's dedicated her career to helping parents and practitioners bridge the gap between conventional and holistic pediatrics with an evidence-based, pediatric-backed and parent-approved approach. She's lectured around the world and been featured on hundreds of podcasts, and now I'm very lucky to say she's on my podcast. So today we're going to be talking about one of my favorite subjects, which is PANS. So thank you so much for joining me on the podcast today, Dr. Song.
Oh, well, thank you for having me. It's my honor.
So PANS is something that you and I obviously know a lot about, but there will definitely be people listening to this podcast who have no idea what we're talking about. So do you want to just start off and tell me a little bit about PANS, PANDAS, as some people may know, and just what that sort of means for a child?
Yeah, so I think I'm so grateful that there is so much more knowledge and awareness about what PANS and PANDAS is. As you and I were speaking offline beforehand, that was nearly 10 years ago when I first came to Australia to really talk about PANS and PANDAS. So I'm grateful that there's increasing awareness. On the other hand, there needs to be so much more awareness, right? Because so many parents and children just continue to be lost without the support that they need when their kids are struggling. And so when we think about what PANS is, PANS stands for Pediatric Acute Neuropsychiatric Syndromes, and that can arise when a trigger, typically an infection, but it can also be mold toxins. It can be environmental toxins or a variety of triggers that then create this cascade of events in the immune system where the immune system becomes inflamed and starts to attack the brain. So PANS is an autoimmune encephalitis. So it's basically your child's brain on fire. And when that trigger is strep, that's when we call it PANDAS, pediatric acute neuropsychiatric disorders associated with strep. And as we see now with kids, sometimes there are multiple triggers and we have to figure out which is the most important one, or maybe there's a combination of ones. Now, how does this manifest in children? The classic presentation is an acute, abrupt onset of anxiety, OCD, regressions, food restrictions, major separation anxiety, tics developing. What I tend to see more in my practice are less so the intense acute onset and more of a subacute, or it's not even subclinical, I would say, a subacute presentation, because the kids who are presenting with severe overnight, like they changed overnight, and it's a Jekyll and Hyde picture where they can't leave the home. They're screaming. They're repetitively stuck in these movements where they can't get out of. They stop eating. Their handwriting declines. They start regressing into baby talk and start having urinary accidents. Those are kids that they're hard to miss, right? Except that many of these kids end up in the hospital on psychiatric units. And I've had this happen to some of my patients where the doctors were not familiar with PANS or PANDAS and treated inappropriately, because when you have your brain on fire and there's a trigger, we need to identify that trigger. If there's an infection, we need to treat that infection, and we need to treat the inflammation. It's not just a matter of giving psychiatric medications. But then there are, a whole subset of children who may not necessarily meet the exact diagnostic criteria. However, they're still suffering. And these are the kids that I want parents and educators and practitioners to know that when kids experience a change in their symptoms, when they go from being regulated, happy, social, being in school, to increasing anxiety, compulsions, intrusive thoughts, and you can see that their handwriting is declining. They're having gut symptoms. They're having tics coming up, and they're quote managing. Maybe they're in school, and teachers are noticing something going on, but nobody is saying, hey, there could be something that's triggering all of this. It's not just a phase. Let's investigate this. And for those kids, it's so important to recognize when there could be PANS, because the sooner we treat, the easier it is to get kids into remission. And it's not to say, I've parents who come to me when we really dive back into the history, and parents note that there was some change that occurred in preschool. Toddlers change, right? Toddlers, can be fickle, but parents note, okay, it was after a certain illness, and they just remember that their child changed a little bit. And then things progressively keep getting worse and worse and worse. When that inflammation has really set in, it's not that it can't be reversed, but it may be a little bit longer of a road. So that's why I think getting this awareness out, so that when parents recognize their child, I just had a child who had influenza, and after the influenza virus started increasing worries, perseverations about the radiator, that the house was gonna, catch on fire, and started hearing voices, and went to her regular pediatrician, and they said, oh, she's just taking some time to recover. And when she came to see me, which was thankfully just about a month after this was going on, because the mother knew this wasn't appropriate for influenza recovery. And we were able to get her on the right anti-inflammatories and antiviral supports, and she pretty quickly recovered. But that's the kind of hope that I have, that parents will be aware of this, so that they can seek help right away, and practitioners can be aware, so that they don't just send parents away.
Yeah. I think one of the first children I treated with PANS, she was put on the psychiatric medication, as so often happens, but she ended up on so many psychiatric medications with side effects. So then actually her symptoms became more the side effects of the medications than
Yes.
anything else. And
Yeah.
then, it's really hard to see the wood from the trees in that sort of situation. What's the side effect and what's actually the condition? And with the sort of more insidious onset, I don't know about where you are, but for Australia, mold is a big, big problem in
Mhm.
homes. And do you find that where you are as well?
It is a big problem. And oftentimes, what I find is, perhaps there is an infection, perhaps there is mycoplasma pneumonia or strep in the mix. But when kids aren't getting making progress, progressing and improving in the way that I expect. Oftentimes, there is mold in the picture that is keeping the inflammation stuck.
Mm.
And sometimes it is mold and mycotoxins alone that is the trigger for PANS. I had this one family where they knew mold was a problem, and they didn't quite recognize how much it was affecting their kids' behavior. It was more mom was having symptoms, joint pains, brain fog, and so they moved out while they were remediating, and they noticed, oh my gosh, their child was all of a sudden not as aggressive and was more regulated. And every time they went back to the house, into that garage to get more of their clothes, toys, supplies, whatever it was, immediately his behaviors would change when they stepped into the home. So for him, mold was the major trigger and the perpetuator. And the problem with mold then is mold and mycotoxin exposure can become an internal infection because those molds then can take hold of the child's, sinus passages or even get colonized in their gut. So then we're dealing with this internal infection that was triggered by the mold exposure. But even beyond getting out of the moldy house, it's treating the mold that's living inside the child and the inflammation too.
Mm. It's news I hate to give people is that it's mold because it
Yes.
ends up being such an expensive process to go through. And so, we often say health starts in the gut. So, what's your approach when it comes to PANS and gut health?
No matter what is going on with the child, so whether they have PANS or PANDAS or they have ADHD or they have an autoimmune condition, I still always start with the gut. So I start with the gut and also looking at nutritional deficiencies or insufficiencies. So there are some baseline blood tests that I do, and if there's PANS in addition to those baseline nutritional tests, I'm looking to see are there some infections that we can detect in the blood. But the reason why it's so important to start with the gut microbiome is because 80% of our immune system resides in our gut. And the crosstalk between our gut microbes and our immune system helps to inform your immune system whether it deals appropriately with infections or whether it creates too much inflammation or persistent inflammation. And in the case of PANS, the wrong kind of inflammation, the kind of inflammation that really is an autoimmune attack on your child's immune system and on their brain and on their bodies. And so when we can optimize the gut microbiome, we can help regulate that immune response. And even beyond that, I have this one kiddo who has PANS triggered from, I mean, likely Lyme disease, but also, we can see that in the blood work, there's some evidence of mycoplasma. And for her, she also had these abnormal bacteria in her gut. There's a category of bacteria called Enterobacteriaceae, like Klebsiella, Citrobacter, E. coli, that some listeners may be familiar with. These in particular are bacteria that are associated with an increased risk for autoimmunity. And so when there's a child with PANS or any autoimmune condition, I want those Enterobacteriaceae out of the gut. And these Enterobacteriaceae also have on their outer membranes, they have this particularly toxic compound called LPS or lipopolysaccharides. And that alone, when these bacteria, they release LPS from their cell walls, and that gets absorbed into a child's bloodstream or an adult's bloodstream, can trigger neuropsychiatric symptoms. And so this one little girl, she did have high amounts of Enterobacteriaceae. She did have high amounts of LPS. And when we were able to get rid of that bacteria, regrow and repopulate with the beneficial bacteria and clear out this LPS, it was literally only a month later that the mom was saying, I am getting my daughter back. She could see, and that's, I mean, a month when you've been living with this for what they had been living with it for years, it's almost seems too good to be true. But when you heal the gut, you send this ripple effect in motion that starts to heal the gut immune system imbalance and the gut brain imbalance that's been occurring.
I think your book is great for, general public to actually break that down, the recipes and everything as well in your book to actually, how does this translate to a child's diet? And I actually got my 10-year-old boy to read your book as well, because I think it's good
Yay.
for them to hear somebody else telling them this stuff that's not their mother. I know there's been research.
Oh, for sure.
Yeah,
That's for me too.
somebody else's mother. There's research around the Mediterranean diet that just switching to the Mediterranean diet in 2 or 3 weeks, there's a benefit for your mental health. But it's so frustrating because when people go to their doctors or their psychiatrists, diet is not even talked about. It's
No.
on the table.
For sure. I mean, food is such powerful information for your brain and for your immune system and your gut in both directions, for worse or for better. And you can't understand the power of it until you try and do it. And um, the other thing too, when we're looking at the gut microbiome, if you have abnormal bacteria or yeast or parasites in the gut, the first instinct, as parents is just kill it, get rid of it, right? But the more important piece of restoring your child's gut microbiome is not the killing so much, but restoring that underlying resilience. And that is only through, foods rich in fiber and phytonutrients, getting fermented foods in, and also equally importantly, getting rid of the junk, the artificial dyes and the flavors and the artificial, sweeteners and food additives that create a gut environment where unfriendly bacteria want to live. So if your child's diet is filled with these, I mean, in the book, I call them microbiome mischief makers because I want kids to remember it too. But if your diet is filled with these microbiome disruptors and you're trying to kill abnormal microbes, well, you might kill them temporarily if you're using your prescriptions or even your herbal medicines, because the gut environment is still more friendly to the bad bacteria coming back in. So we need to create that environment, that ecosystem. If you're growing a rose garden, I mean, you wouldn't think to just let the soil rot and dry out and not nurture it if you want the healthiest roses to stay and the weeds to naturally, be kept out. It's the very same concept with your gut microbiome.
And I think the most obvious example of that to parents is threadworms or pinworms, as you call them. If you just kill them every month, you'll be taking the worming tablet to kill the worms. So you need to work on, I just call it the rainforest, like get the rainforest going in your gut so that the threadworms can't take up residence and you don't have to just kill, 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 kill.
That's right. That's right.
Yeah.
Because I mean, if you've ever had pinworms, they can be really difficult to treat, if we're not, and I mean, really very annoying to have, right? If we're not really creating that healthy ecosystem, that rainforest, as you say. I love that. And really, the other point with that too is, we want to create a rainforest for the whole family because we do share, about 25% of our microbiome is from those we live with, those closest with us. And so it's not just a matter of, if Johnny is the one who's sick in the household, we're just going to focus on his microbiome. We need to focus on restoring everyone's gut microbiome because otherwise, and for parents, oftentimes we'll do much more for our kids than we do for ourselves. So, if that means then enforcing, healthy diet and lifestyle and self-care, for the sake of your child, then fine. But I want you healthier too, right? Because that is going to help your child be healthier.
Yeah, absolutely. And so the problem with a lot of kids with PANS obviously have severe restrictive eating.
Yes.
And so when, I say, right, we need to work on diet, we need to work on gut health, it's so much and it's so overwhelming. So how do you break that advice down for the child who's only eating, rice crackers and donuts? Where do you
Yeah.
start?
So, I mean, part of that is really the inflammation that's keeping their brain stuck in this mode. And so, if it means then that we hold on the diet, but we're working on supplements like curcumin or, your omega-3s, I don't know if yet in Australia you can get specialized pro-resolving
Yeah,
mediators.
you can. Yeah.
Great. Okay, because when I came to lecture, it wasn't available, but now like these SPMs are a mainstay for my kids with PANS, PANDAS to help resolve the inflammation. And when we help resolve the inflammation that has gone awry, that alone is one of the most important steps in helping your child's food restrictions to open up. The other thing too is making sure kids are getting adequate zinc. And so a zinc supplement is often a part of my main protocols because zinc is important for healing the gut, it's important for the immune system, but also zinc when we're deficient or insufficient in zinc, it heightens all of our sensory systems. And also makes it harder to get over infections. So with PANS and PANDAS, we're really using zinc for multiple reasons. But when zinc is low, it alters our taste sensations. It can make things just taste not as good. So we want the same thing. It also heightens our sound sensitivity, so kids can get really really sensitive to noises, even noises that aren't that loud. I mean, some kids, they will refuse to go into a public bathroom where the fan turns on, right? But I've had some kids with PANS where they develop something called misophonia, which is a fear of sounds. And this can be heartbreaking because oftentimes it's interesting. The few kids where they've had very significant misophonia, it was literally the sound of other people chewing that would set them off. And I had this one mom come in where she was talking very quietly, slowly, and deliberately, and she had a scarf around her neck, even though it was warm outside. And so when we were able to when the son just went out into the waiting room for a bit, the mom said that even just he would watch her throat because even if he detected that she might just swallow, it could send him into a rage. And so, so that was one of the first things, once we made progress, reduced his inflammation, and they were able to sit at the dining room table together and eat. I mean, that was the biggest goal for her was just to be able to have a meal together because they had to, she said it had been, I mean, months and months and months and months since they ate together because she would have to eat on the other side of the house where he could be assured that he wouldn't hear her swallow at all. So you hear these heartbreaking stories, but this is what happens, with our kids with PANS and PANDAS. And for this family, it took a while for them to get seen because, as parents, especially as moms, we learn how to accommodate our children, right? We learn how to um, create a situation at home that becomes manageable for the child, but is not sustainable anywhere else. And we stop realizing that this is not okay, that it's not normal, and that we need help for it. And so I was so glad that she was finally able to get that support, but it took a while.
Yeah. And do you have any favorite prebiotics that you use in kids with PAN?
Mm. A wide variety. I mean, we know that there are so many different beneficial microbes that benefit from different fibers. I think the most important thing is getting in polyphenols, and so I do have a favorite. I don't know if you have get Nutridyne in Australia, but they do have a polyphenol rich prebiotic. So it has the kiwi fruit extract from New Zealand that has been found to increase your butyrate producers, so your Faecalibacterium. It has a xylo oligosaccharide that's been found to increase bifidobacterium, and then polyphenol rich, cranberry, pomegranate extracts that increase akkermansia. So these are all of our keystone bacteria, but pure encapsulations, which I think you can get in Australia, also has I think it's called a polyphenol pro or something like that. But again, looking for all of these polyphenols is really important. And then, when we're looking at fibers, then getting in a variety of fibers. So I love the baobab fiber that you can find in different fiber supplements. You can also find PHGG. It's a guar gum polyfiber that also has been shown to improve beneficial flora. I think the branded one is called sun fiber, really easy to dissolve in water. So I just think a variety if we can. The sun fiber is nice because it dissolves pretty easily and doesn't really have a taste. And so that's something that would be easy to drink and mix into your child's drink.
Yeah, we love that one. We go through tons of it.
Yes.
And what other sort of lifestyle factors do you look at for kids with PANS, like things that people could do today in their home or start to evaluate today in their home?
I think sleep is really medicine, right? And there's so much that happens in our sleep. A lot of people think of sleep as a very metabolically quiet time, but it's actually one of our most active times in terms of detoxification and what happens to our brain. And our brain in our sleep will literally shrink about 60% of its volume to be kind of bathed by its very own special lymphatic system called the glymphatic system that brings in nutrients and clears waste from the brain. So it's a very important process. And also, it's in our sleep that we lay down memories. And so when we're trying to help our children with cognitive behavioral tools, they need that sleep to really imprint those tools and be able to use them. So whatever we can do to help support sleep, L-theanine is one of my favorite supplements to support calm and also healthy serotonin levels and help with sleep. And for kids, you can actually dose them. I mean, even up to 300, 400 milligrams is sometimes what I'll give for kids when they're really inflamed. So doing theanine, GABA is often very helpful for kids for calming their brains as well. And in fact, you need healthy microbes to produce your GABA. So that can be really helpful. For many kids with PANS or PANDAS, they are oftentimes indoors for much of the day. A lot of fear around going outside if they're not able to attend school. And so, even just making sure they're getting, out in your backyard, sunlight during the day, even if it's just for, 10 minutes in the morning to really help their circadian rhythm stay balanced and not have them, stay up all night because that is going to really hinder their healing. So, I do prioritize sleep when we can. I mean, I love, working on vagus nerve support for kids. And so, because the vagus nerve, a lot of people think that the vagus nerve is only about the parasympathetic, calm, rest and digest, healing state, which yes, it is, but also your vagus nerve is intimately involved in inflammation response and inflammation resolution. And so, when we think about supporting your child's vagus nerve, it is, yes, it is to help them feel calm, but it is also not optional because it is also to balance their autoimmune response and their inflammatory response. So, when kids are inflamed, it can be hard to get them to practice breath work. I mean, even when kids are neurotypical and not inflamed, it's hard to do that, right? But we practice that. You want to practice that co-regulation, when you're just even laying with them and you can slow your breath and, really, use your belly to do diaphragmatic breathing. That co-regulation, even just having your child next to you while you're doing that, does help regulate their nervous system. But things that are a little bit more passive, that they don't necessarily have to mm, do for themselves, but can get the tools so that when they feel well, they can do for themselves. I love emotional freedom technique or tapping, where they can tap on, some of their acupuncture points, or you can tap for them as you're repeating certain, affirmations. And that really, there is evidence to show that it improves your vagus nerve. It improves your mood, OCD thoughts, those kind of addictive OCD thoughts. So doing tapping, we have in the States certain vagus nerve devices that can be used, whether they, clip on the ear or they wrap around your neck and stimulate, your vagus nerve as it's going down your neck. Or, I'm wearing a device called the Apollo. I don't know if you can get that in Australia, but this is something for kids. If you could just put them on, and there's certain um, vibroacoustic patterns. So they use sound and vibration to stimulate your vagus nerve, and the frequencies are set at different. I guess you'd call them wavelengths. I don't know if that's the right terminology, but to promote calm or help with sleep or help with focus and energy. I mean, there's different settings, and it's so easy just to put it on your child and set the vibrations going. So if you have something like that where you can passively engage your child's vagus nerve so that they can get into a place where then they can use the tools that you're teaching them, like belly breathing or, your cognitive behavioral techniques.
Yeah, that's a great idea. I've never come across that sort of wearable device. But I can think of lots of kids I will be trialing that with.
Yes,
And you
yes.
mentioned acupressure as well. Do you just teach kids what points to kind of use or?
If you get I'm sure in Australia you can get acupuncture ear seeds, they're
Mm,
called, right? And here in the States we have ear seeds that are, kind of fancy little crystals that some kids like. But even just putting, you can look up one point called Shen Men, which is the spirit gate, and it's literally in that the smooth rounded part in your ear, like right here, literally in the middle. But you can also look up online Shen Men, and if you put an ear seed there, I've done that for kids, and then they can just massage that point when they're anxious or if they're needing to go to bed. It's a really great relaxing point. And that point, Shen Men, is also on your wrist, and so you can teach your kids. Actually, the best point I think for calming is it's called pericardium 6. So that's another point that kids can learn to identify. You can Google it and find out where it is. But if you go to your inner wrist crease, and it's about three of their fingers down from their wrist. So
mhm.
right at that point, they can just hold and massage that, little circles, even put some lavender essential oil. So it's interesting. This is a spot too that's really good for motion sickness. So my
Well, that's
son
what I was
knows it
going to say.
well.
That's the only acupressure point. I'm like, hang on, that's where the acupressure bands go as well for cardio.
Absolutely. So it's good for, I mean, you could get those acupressure bands. It's good for motion sickness. It's good for anxiety. It's good for helping promote sleep and calm. And so this is a really good one that kids, even like if they're in class and they're getting anxious, they can just, I mean, even just kind of hold their wrists like this and with their fingers be pushing down on pericardium 6. Nobody has to know what they're doing.
Mm,
Right. So that's another point. But if they want to wear those, there are, I do get motion sick. So I love I think it's called a C band,
yeah.
where it actually is a little electric stimulator. It looks like a watch, but you put a little electro gel and there's two little metal prongs and it just goes bzz, bzz, like
Yeah.
little zaps it. So you could do that as well. I actually forgot about that when you said the C band. That is something that kids could use too.
Yeah.
Just put it on and passively stimulate that point. That's a
That's like
great idea.
$20 from the pharmacy, like very easy
Yes.
to
Hmm.
just introduce. And so you mentioned lavender. Would that be your favorite essential oil for these kids?
It is. Lavender has a lot of good studies on helping with calm, anxiety, with sleep. It also improves vagus nerve tone. So it improves heart rate variability. I think sandalwood is another one that's been shown to improve vagus nerve activity, vagal tone. But lavender is really safe, in pretty much all ages. And it is one of the few essential oils that can be used, quote, neat, meaning you don't necessarily have to even dilute it. So, we have a little bottle of lavender essential oil and you can just, dab it right on and just, massage that point. But it is also something too that, for kids, if you could easily make them a little roller ball of lavender essential oil, fill up the ball with something like fractionated coconut oil that stays liquid at room temperature or jojoba oil. And then you just fill up a roller ball with with some of that oil and then put in, maybe 5 drops of lavender essential oil or I love neroli, which is like a sweet orange
Yeah.
um, a citrus scent, which is very uplifting. So if your child has favorite ones, I mean, you can have them smell and decide which ones they like and just put a drop of each of them in there and then snap on the roller part. And then they can just take that to school with them or wherever they are and just, kind of roll it on their neck
Mhm.
when they're feeling a little anxious and then just like slow down their breath and smell it.
We have the little inhalers, but actually, I always forget to use them as well. And they've got the wick inside, which is the same thing. You
Yes.
give it a, just take a little sniff. And so, what about medications? What do you feel about the role of medications when it comes to PANS?
I think sometimes it can be necessary. And as much as I, want to be very mindful and judicious in the use of medications, they can absolutely be a game changer for kids. I mean, if they have strep, then I do use antibiotics. Now, my book is all about, supporting your child's microbiome, and antibiotics can wreak havoc on your gut microbiome, but we have to balance it out with the inflammation that's going on in their brain. And so even while, they're on antibiotics, you definitely want to double down on, their, diet and lifestyle to support their microbiome to continue to be resilient so that we don't have, these abnormal bacteria that tend to be antibiotic resistant, take hold. The other thing that can be really helpful during heightened PANS and PANDAS flares are, ibuprofen over
Yeah.
the counter. And also, on occasion, I do use prescription steroids if there's such fire that, kids are so inflamed that we just have to put out the fire and then rebuild and start from scratch. I do really think that compounded low dose naltrexone can be very helpful. I don't know if you can get that in
Yeah.
Australia, but that also can be, the specialized pro-resolving mediators, the SPMs, and the low dose naltrexone, the LDN, are the two things that my patients, you know, uh, pretty much across the board will say are the biggest needle movers for helping control the inflammation for their children.
Mm, I agree. I mean, if your child is, running around the house with knives or trying to jump off a building, then I would absolutely go for whatever it takes
Mhm.
to get on top of that quickly. I have just enjoyed this so much. So, do you have any like last words, closing thoughts about PANS and kids' health in general that you want to share with the listeners?
I think that the main message is to just not give up.
Mm,
PANS is very occasionally it is a quick
yeah.
fix. I mean, I've had some kids where, one round of antibiotics and some anti-inflammatory herbs and they were good, but that's not the norm. I mean, the norm is to have ups and downs and flares and then getting better. And then it's just important to, periodically when you're in the middle of that flare, just look back at where your kids were when they started because we just want to make sure they're going progressively up, which they do. But flares can happen and often happen. And so just to not be disheartened, and to keep going.
Yeah. I always say to people, you have a choice to do something or to do nothing. So
Yep.
I always encourage people to do something. And
Yes.
obviously, there's your wonderful book, which people can buy to read more. And your website also has lots of helpful information. Yeah. So,
Yep. Yeah. So that my yeah, and then also I'm the most active on Instagram if anyone does Instagram. So
yeah,
that's healthy kids underscore happy kids.
awesome. Well, thank you so much. And yeah, it's been wonderful. I really appreciate your time.
Well, thanks for having me.
Thanks for tuning in to Holistic Health for Happy Kids. I hope you found today's episode helpful and inspiring on your journey to raise thriving, healthy little ones. Remember, small, consistent changes can lead to big transformations. If you enjoyed this episode, please subscribe, leave a review, and share it with other parents who might benefit. You can also follow me on Instagram and Facebook at the Paediatric Naturopath for more tips, tools, and inspiration. If you've got a question or a topic you'd love to hear about, please send me a message. I'd love to hear from you. Until next time, take care and keep supporting your kids in the most natural, nurturing ways possible.